In today's video, I'll be discussing some key topics surrounding remote working or telemedicine or telehealth in general practice. I'll discuss what is remote working, why I chose to work remotely, and some of the pros of remote working or digital healthcare for both patients and GPs. In the second video, I'll talk you through some of the cons or disadvantages of remote working. And welcome back to my channel. If you're new, then a massive welcome to you. My name is Dr. Baptiste and I work as a portfolio GP. If you haven't subscribed already, then why not hit that subscribe button so you can be supported along your medical career journey wherever you are. And be sure to hit that like button if you gained value from the video. Currently, I work remotely. If you didn't see the last video where I spoke about my career and what I'm doing now, then be sure to check that video out because I talk you through some of my reasons for leaving my job and what I'm doing now, which does involve remote working. So what does remote working or remote care or digital healthcare involve? Remote working, as you may know already, means working outside of the traditional office or clinic environment. In general practice, it can mean this, but primarily I would say it describes seeing patients via telehealth or telemedicine methods. In the general practice surgery, but of course from home as an NHS doctor or working for a private company. Of course, during the pandemic, there have been less face-to-face consultations compared to those using telehealth or telemedicine. So for example, video and telephone consultations, SMS or text messaging and email. To further answer that question, I'm going to insert a video I recorded earlier. This video discusses the types of consultations currently used in general practice, and this video didn't make it into the vlog, a week in the life of a GP, as I didn't want to make the vlog too long. I'm also going to include working from home in working remotely, but of course GPs work remotely from the GP surgery. So what are the main types of consultations in general practice? So the main types of consultations are of course face-to-face, but we do less of those now. There are telephone consultations, the majority of what I do now anyway. Then you have video consultations as well. I will class e-consults just because although they're not like a consultation, there is still a large proportion of the consultations that we do where we receive e-consults, text messaging or SMS. Okay, so let's talk about telephone consultations. So patients can call up, they can call the surgery and book an appointment, they can go online and book an appointment via web, and like I said, they can use e-consult, so they can go online, fill out a form asking for advice or explaining their symptoms to us, and then someone will pick that up. So with telephone consultations, you can assess patients well via telephone, but of course you lose some essential body language and cues that you would get from face-to-face consultations. However, with telephone consultations, you can assess the patient, you can triage the patient. We do have a certain number of appointments available per day so that we can bring patients in face-to-face if we need to see them. So when I'm at home, I don't use my phone to call patients. I use a website, which I'm going to show you, so you can have a look at that. And you can do video consultations via that website as well, but I use it for calling. We do also have something called AccuRx. This is where I send most of my text messages to patients. So when I start a telephone consultation, I usually start by introducing myself. I say, hello, my name is Dr. Baptiste. I'm calling from X location or X surgery. And then I will proceed to confirm the patient's identity, because over the phone, you don't know who you're talking to. Is it the patient? Is it a relative? Is it someone else? Have you got the wrong number? So I always ask for their full name, date of birth, and you can also ask for the patient's address. Usually 2 out of the 3 would be fine, but of course you can use all 3. As long as you confirm the identity, that is fine. And then of course, if the patient wants you to speak to someone else, or if it's a relative or carer, then you have to make sure that you're gaining consent to speak to that person if it's not the patient. Then of course what you want to do is explain the purpose of the call, the purpose of the consultation. Are you calling them to inform them of blood results? Are you calling them because they've requested a call back, they've requested an appointment? So it's really important to start off by just understanding what is the reason for this appointment. Another good point here is to ask the patient if it's a good time to speak. They could be at work, or they could be with other people, and they may not want to talk about something sensitive or something confidential essentially with those other people. So it's always good to ask them if it's okay to talk, and if they need to have time to go into another room or to go somewhere quiet or somewhere more private. So I'm not going to talk about history taking. I have a series called 5 in 5. If you are a subscriber to my channel, you will know that that series is more clinical. So check that playlist out. There's loads of information about history taking and so on. You can conduct some kind of examination over the phone. Of course, it's not ideal, but certainly many patients now will have blood pressure machines and are able to use those quite competently. On the blood pressure machine, you'll also have the heart rate. So though you should still feel or palpate the pulse, some blood pressure machines do tell you if the pulse is irregular or regular, so that's really useful. Parents have young children, they might have thermometers at home, and some people generally do have a thermometer, so that's also good to check the patient's temperature or check the child's temperature. I'd be wary of using kind of apps and smartphones to record observations. And of course you can ask questions like, if it's a child, what are they doing now? Are they playing? Are they drowsy? Are they alert? So there's a lot that you can get from asking patients specific questions, and also asking them if they have any measurements, any things that they can use to record vital observations at home. And of course, like with any consultation, you close the consultation, you ask the patient, do they have any questions? You explain the management plan, you chunk and check information, give the patient time to digest everything that you've said. And of course, you safety net. Now, I'm not going to talk about safety netting here. I'm going to save that for another video in the series 5 in 5, because that does need a bit more time to talk through, and I don't have that time here. The next consultation, I'm going to talk you through video consultations. I personally don't use many video consultations. I prefer to actually bring the patient in. I just find that's better overall, but of course you can definitely use video consultations. You can assess the patient's body language, you can see things like rashes, but sometimes it is a bit difficult, so I prefer to bring patients in face to face. And I'm going to leave a link in the description box below the video for more information from the RCGP about video consultations. Like I said earlier, we do use eConsult. I'm just going to take you to the website where you can have a look and see what eConsults are. Like I said, the patient will go onto the website and they will complete a form, and then we will get that at the surgery and we can look at that. Sometimes you have to bring the patient in, sometimes you give them a call. It depends what it is. Sometimes you don't have to call the patient, but I think a lot of patients expect a call, and sometimes you have to call them to get more information. So they generally turn into telephone or face-to-face appointments. They are very good. Text messages. So if I call a patient, I generally call a patient a minimum of 2 times. Usually I call them 3 times, but a minimum of 2. And if they don't pick up and I can't get through to them, then yes, I can leave a voicemail if there's a facility to do that. And even if there is a facility to do that, so either way, I will still most of the time send them a text message just to say that I haven't been able to get through. If they still require an appointment, they can rebook. So why did I choose to work remotely as a GP? There were many reasons, which I do talk about in an earlier video, which I did mention at the start. In that video, I did speak about why I resigned from my role as a salaried GP. Now I'm going to discuss the pros from both the GP or healthcare provider and the patient perspective. Number 1, safety for both staff or GP and patients, especially during the start and peak of the pandemic, but of course even as lockdown restrictions ease and disappear. Number 2, flexibility. GPs can work from home, especially if self-isolating, and can even work when out of the country. This may help with recruitment and retention of staff or the workload, and it fits well around some of the patients' busy lives, enabling them to minimize any time lost coming to the surgery. As a patient myself, I prefer telephone appointments before the pandemic. I would also add here that carers and relatives may not want to leave their loved ones, and so having a remote appointment allows them to remain close by. Number 3, shorter waiting times. This may enable patients to be seen more quickly and allow time for other important things such as signing prescriptions, audits to improve patient care. As an example, there are e-consults, which is a form that patients can complete, which does provide the GP with a lot of information if filled out correctly. Patients can also upload photos too. The GP can then email or call the patient back if they need to clarify anything. For patients, there may be less time spent waiting in the surgery or the hospital to see a doctor. Rather, you can be productive at home as a patient or at work. Number 4, productivity levels. Some GPs may find that they have higher productivity when working remotely, as fewer distractions in the workplace. Number 5, cost effectiveness. GPs may save time and money on commuting to work if consulting from home or elsewhere, and no need to pay for hardware or software as CCGs or GP practices provide the equipment. Travelling to the GP surgery or hospital appointments would incur costs for patients. Number 6, mobility issues. It's easier to consult at home with the GP instead of coming into the surgery. It may be difficult to mobilise because of a physical impairment. This is also good for some patients with mental health conditions or substance abuse. Some patients have expressed difficulty with leaving the house and or the stigma associated with those conditions. Number 7, multiple tasks can be completed easily. So GPs can complete tasks remotely, which may mean less appointments are needed for simple tasks such as medical certificates. You can sign with an electronic signature and also maternity exemption forms. Number 8, it's easy to support staff remotely. Staff can be supported in the form of Microsoft Teams, WhatsApp groups and other methods to ensure GPs do not feel like they are working in isolation. Number 9, patients can record some vital observations at home, such as blood pressure, heart rate, height, weight and temperature, and even their SpO2 or oxygen saturations. This means that patients can receive the treatment that they need, such as the contraceptive pill or antibiotics. So that is a short summary of a few pros of telemedicine or telehealth care or remote working. In the next video, I'll explore the disadvantages or cons of working remotely. As always, if you enjoyed the video, then be sure to give it a thumbs up and subscribe if you haven't already. I will see you in the second video where I talk about the disadvantages of remote working.